for us to give you an update in terms of the meeting we held with our employer at the Parliament House yesterday. So I'll go ahead to read the statement. Following the unilateral rescheduling of the meeting with the Parliamentary Select Committee on Health by the employer from 26th June 2025 to 10th July 2025, the meeting finally came off at the Parliament House at 2 p.m. on 10th July 2025. The parties present were the Ministry of Health, Ministry of Finance, the Fair Wages and Salaries Commission, and the host, the Parliamentary Select Committee on Health. In the said meeting, it was clearly communicated by the Honourable Minister of Health that the government's position on our demands is to capture only the book and research allowance and the uniform allowance in the mid-year budget. The association's position communicated in the meeting was that it was highly unacceptable and buttresses our long-standing assertion that our employer does not place premium on our welfare as nurses and midwives in Ghana. We therefore strongly urge the employer to reconsider its position and include the two other items communicated as priority items from the association in the mid-year budget. We wish to put on record that we are here we are because someone chose to forget the collective agreement of nurses and midwives of Ghana during the transition from the previous government to the current government, and therefore it was never up for discussion. We are here we are because someone chose not to include the cost of our collective agreement in the national budget read on 11th March 2025, despite the repeated assurances given to the leadership of the association that it was being worked on. More importantly, we are here we are because a session of our own colleagues chose to engage in unnecessary litigation at the expense of the welfare of the close to 125,000 nurses and midwives in Ghana. The National Council of the Association, at its emergency meeting held on 10 July 2025, deliberated extensively on the recent developments and wishes to state as follows. 1. The reasons for the non-inclusion of the 8% non-basic allowance and the full allowance in the mid-year budget are untenable, and therefore the leadership of the association will avail itself for the meeting scheduled for Tuesday, 15 July 2025 by the Fair Wages and Salaries Commission to discuss these further and push for their inclusion in the mid-year budget. 2. On all the other items spelled out in the Appendix B of our collective agreement, we wish to reiterate our position that they must be captured as part of the national budget for the year 2026, which will be read in Parliament in November 2025. 3. Our subsequent actions as an association will be greatly premised on the outcome of the meeting to be held with the Fair Wages and Salaries Commission on 15 July 2025, and therefore call for the commitment and good faith in the engagement, because we shall advise ourselves should the engagement fail to address our concerns. 4. We thank the chairman, ranking member, and all members of the Parliamentary Select Committee on Health for their efforts towards finding an amicable resolution to the implementation of our collective agreement. 5. To our dear nurses and midwives across the country, we are grateful for your continued show of solidarity and wish to assure you that we are in this fight together and will continue to lead in protecting your interests now and in the future. Meeting be a your employer Asia or Parliament House on 26th June. Emom de ba echire ne say omutu share da share 10 July 2025. Inti eye enra 10 July 2025. Ye bo modern eko Parliament House. Eko sa meeting no ye call ye no na empenyimfo a omodom Parliamentary Health Select Committee on Health. Ewo hobby. Fair Wages and Salaries Commission ewo hobby. Ministry of Finance ewo hobby. Ena ya sector ministry, the Ministry of Health eso ewo ho. The omode two ye nim ne say eya asema ya minister e two dwa ene say government's position efa ye demands no ene say enioma mienu no betumi aye e de aka media budget ne ho eye book and research allowance ene uniform allowance. Yama omuti ase say nioma nine na ye two omanim the last time ye share omo no no na ne ye hwe nim say omo be ka kire say omo de account nioma mienu no it falls below our expectation enti yesra omo a omo hwe no mo fasa nioma mienu na aka no enka ho na de aka echire nyina no nyame ye adom na omo prepare budget for 2026 na omo de nini na aka ho se na ebe ya ye ko run next year mu a yen sabeka sa na oma nini na enti ye wi meeting no yeso ye ne empenyefo a omo dom National Council no ishia anadwo no na ye to adwen no de ebe chire ene se de edikan ye de omo ka kire efa de enti a omo anfa 8% non basic allowance ene fuel allowance no anka ho no ye hwa enya asema ye betumi age atum enti no fair wages meeting na omo frey say emra Tuesday 15 July 2025 no ye because our meeting na mom ye bo omo kokko say ye ne nioma ye be ni na if after 15th of July no ejina 15 July no sene nioma besi akọ enti yesra omo say omo ma commitment and a good faith in leading in that meeting. After so yesra your employer na say onhwe na nioma eda yakoma so na yaka kire omo no omo hwe na omo fanka ho de ka ho biom no yeda Parliamentary Select Committee chairman nase ranking member ene members a omakani na a omaka sa committee no ho yeda omase say oma bomoden oma try say ye nioma higher fire collective agreement implementation no almost so aye omo kakra omo betumi aye omaye afa so yeda ye nurses ne ye midwives omo wo Ghana fa ne na se omo koso etai echi ema ye dwuma e wo se ye pay a mandate as leaders no omo tai echi ema ye koso ye sha omo bo se ye be koso ni ako ekon a eden ahwe se omo asitinem as nurses and midwives ebe improve ene ni ochina ni dan nyina Ghana Registered Nurses and Midwives Association ejira ho ma omo ye bekoso aye adwumaden sene ese na efata ye sa sha omo bo se senioma anko sene esa we shall advise ourselves na ye ka say we shall advise ourselves a twi mu ne ye beka say ye betu ye ho fo a obi enim de kire enti we ni asema ye de tu manim anope ye damose. There are numbers, as it were, is the same numbers that provide health services for the good people of Ghana. When we go to work on our shift, morning shift, afternoon shift, night shift, we don't go to sleep. We go to work. Every minute, every hour, the 8-hour shift, the 4 hours in the week, sometimes more than the 40 hours in the week. What do? We provide nursing and midwifery care to our patients and provide services to our outpatients and do whatever is required of us, whether we are in clinical practice, whether we are in education, whether we are in rehabilitation or public health. We do what is expected of us with the numbers. And it adds to the achievement of the targets of the nation. So whether it's primary health care, or working towards universal health coverage, or working towards the SDGs, it's the numbers. So we have no intention of intimidating anybody. As far as we are concerned, government is a continuous process. It doesn't matter if the political parties change. Government is government. Our employer is our employer. It stands to be the Ministry of Health and its agencies. All that we are asking for is the implementation of our collective agreement signed. There are so many items in the collective agreement, the monetary and the non-monetary. For the monetary, it adds up to about 8 items. What we have said is that we are agreeable. Implement the 4, at least for this year. And the others, it can be pushed into next year. So if you come and tell us that out of the 4, you are doing 2. It is 2 out of the 8. It is not 2 out of the 4. So it doesn't make it a good outcome of the engagements that we have had. All we want to let you understand is that what we feel is that we are not being treated fairly as nurses and midwives. It is not fair. When we work in the same health space, and what do we see? Others are enjoying the same thing that we have asked for. And we signed ours way back in May 2024. We are not being treated fairly. And the unfortunate thing is the politics that we've allowed to surround all this. As a country, we must purge ourselves of this NDC MPP thing. It doesn't augur well for economic development. It doesn't augur well for the growth of the economy. It doesn't augur well for our existence as citizens of Ghana. It is not good. It does not help anybody. We are nurses and midwives. We give care. We have taken an oath, yes, to give care. But as essential health workers, it means that when matters affect us, urgency must be applied in addressing the issues. You can't tell us we are essential health workers, we have taken an oath, so we should keep quiet and live in the difficult conditions and challenges we face as workers, and still be able to provide the services that is expected of us. We want Ghanaians to understand, and we want His Excellency, the President, to understand that we are not being treated fairly. They should look at our issues again. Because when they do it for the nurses and midwives out there, they are doing it for them. They are not doing it for me, Perpetual Ofori-Ampofo, or the General Secretary, or the leaders of the association. They are doing it for their people, their own people, nurses and midwives of Ghana. And we are also taxpayers. We pay our taxes. We deserve to be treated. We deserve to enjoy from the same taxes we also contribute to. The national cake that is provided, we should also enjoy from it. It is what? Social justice. We need to be treated justly. That is all that we are calling for.
Madam President, I may have to ask you a slightly digressed question, but much related. I cited a document or a statement from your premises indicating how CHAG actually has dealt with some of your members when they embark on the strike. What do you have to say? What is your take on this? Thank you.
We have been on that road with CHAG before in 2020 when we went on strike. What we want CHAG officials to understand is that as nurses and midwives working in their various facilities, we are still employed by the government of Ghana, and we are paid by the government of Ghana. CHAG doesn't pay us our monthly remuneration. CHAG doesn't pay us what is contained in our collective agreements. CHAG and whatever minimal allowances they pay to some of our colleagues, it's not even, it doesn't cut across all nurses and midwives who work in their facilities. What we have done is we issued a statement, we have given them a copy of that statement and said that all those draconian policies they want to met out to our nurses and midwives who participated in the actions we took. Those nurses and midwives didn't do it on their own. We gave the directives as leaders. They should go and check the Labor Act, the provisions in there, and what is expected of them as an employer. We have asked our lawyers to also serve them a letter, and we have stated clearly, if they go by what they have communicated to the heads of their facilities or agencies, we are going to take them on one after the other. We will take them on. We will take them on because it's unfair labor practice to intimidate or to discriminate against a single nurse or a midwife or a group of nurses or midwives for participating in an action that was directed by their trade union. It is not acceptable. Absolutely not acceptable. And therefore, we will act to protect our nurses and midwives at any point in time. We are only asking them not to proceed on those lines because it will take us on a collision course which will not augur well for the health system of Ghana. Thank you. What it is that we have called for is that we want the 8% non-basic allowance, we want the full allowance, we want the uniform allowance, we want the book and research allowance to be included in the mid-year budget. The outcome of the meeting was that only 2 out of those 4 will be included, and that everything else may be considered for the 2026 budget. And we have said that already 1 year and 1 month of the life of our collective agreement is already gone. And therefore, all the other items within the collective agreement which could not be incorporated in the mid-year budget should be included in the budget to be read in November so that it can be paid in the year 2026 before our collective agreement totally expires. So those are the 4 we wanted included. As for the other 4, it includes the rural incentive allowance, it includes the on-call facilitation and other items. In terms of their rotation or internship allowances, that is also an important issue that we are following up on. We also know there are thousands of our younger colleagues who have completed their training, completed their internship, hoping to get employed in the public sector, and they are also still not employed. Altogether, about 62,000 and over. We are still going to engage the employer about these things. And we know we have 2021 batch, 2022 batch, and the 2023 batches who are all waiting to be employed. So these are very important and pertinent issues that we are already working in the background on, and it's not everything that will come back to throw out there. But I want to assure our rotation nurses, our unemployed nurses, our nurses who were posted in December 2024 and have still not received their salaries that we are seriously working on these things, and we'll come back to you when we have concrete information.
Thank you, Madam. Madam Yasantua, I believe in you, but I have been denying my promotional interview because I'm told my PIN is not renewed. Please please do something about this.
Our largest employer, the Ghana Health Service, has communicated from the headquarters through to the regional health directorates that PIN renewal or iron renewal should not be a requirement for this year's promotion interview. And we expect that all the other agencies, CHAG and the teaching hospitals will consider same, because the engagement we are having with the employer is still ongoing. It is not concluded. However, it is clearly stated in our collective agreement that the employer will be responsible for the PIN and I renewal and at the same time be responsible for continuous professional development. So it is their responsibility. If it is your responsibility and you haven't done it, why will you victimize the same employee for what you haven't done? Excuse me to say, it doesn't make any sense. So we are calling on our employers, the Ministry of Health and its agencies, to take these matters seriously and communicate to all their directorates, all the branches, all the facilities to do the needful. To do the needful. We know some facilities have already done what is expected of them. Others haven't done it. We encourage those who haven't done it to do what it needs to do. And we also want to encourage our regulator, the Nursing and Midwifery Council, to understand that we are still on this engagement with the employer, and therefore they should also progress slowly on this matter and not victimize our nurses and midwives in any way because their pains or eyes are not renewed.